The endocannabinoid system, one of the ligands present, which I'll discuss in a minute, is anandamide. It binds to the CB1 receptors. So this is an interesting mechanism to look at because the endocannabinoid system appears to not have an effect on the acute reinforcing effects of cocaine. Mice without the CB1 receptors can still learn to self-administer, and blockade of the CB1 receptor does not inhibit cocaine self-administration. But there does appear to be a role of the endocannabinoid system on stimulant use. CB1 receptor antagonists inhibit cocaine and cue-related relapse. However, it does not attenuate stress-invoked relapse. And cannabinoid agonists can provoke relapse to cocaine-seeking behaviors following a withdrawal period. And again, the literature on exercise and endocannabinoids is fairly limited to this point. However, we do see increases in anandamide following acute bouts of exercise, and endurance training can reduce the expression and density of the CB1 receptors. So finally, I'll conclude with a few of the more recent studies that have actually looked in animals at the effects of exercise on cocaine self-administration. So this first study is a study that came out just a couple of years ago. You have sedentary mice and exercising mice, and what we see is the reinforcing effects are not eliminated, but they are attenuated following exercise. So we have 2 doses of exercise plus saline solution, and the amount of responding or lever presses. And you can see that they increase with an increased dose of cocaine, but that in both groups, but that at both doses, the exercising rats responded less, suggesting that the reinforcing effects were at least attenuated. Exercise has also been used and demonstrated to reduce substance priming-induced reinstatement. So we have 4 groups here. The first, or the bottom here, is an animal that their running wheel was locked the entire period of the study. Here, the animal only had access to the wheel during extinction. The dark bar, the animals had access to the running wheel during both extinction and during reinstatement. And then the top bar here were animals that only had access to the running wheel during the reinstatement period. And so here we see with greater doses of cocaine, we find some significant results. What we find is that exercise was necessary during the reinstatement periods. Those animals that exercised during extinction but then did not have access to wheel running during reinstatement increased their responses in self-administration of cocaine, but those animals that had access to wheel running during the reinstatement period did not reinstate as greatly their drug-seeking behaviors. And the final study, so the last one was looking at drug-induced relapse. This is going to focus on behavioral or environmental cues. And we see these animals were taught to self-administer cocaine over 10 days. Following that 10-day administration period, the cocaine was removed and extinguished over 14 days. The behavior was extinguished in both groups, sedentary and exercise. During that forced abstinence, they had access to wheel running 2 hours a day. And we see that during reinstatement, a significant reduction in reinstatement of drug-seeking behaviors in those exercise animals. So this is slightly different than the previous study I presented in two ways. This is looking at an environmental drug-related cue, and these animals did not have access during that reinstatement period to the wheel running. So it appears that the continuation of exercise may be important in reducing the priming-related reinstatement of drug-seeking behaviors, but is not as necessary in reducing the drug-seeking behaviors of a drug-related cue.